Good evening. I'm Chris Childs, and welcome to the Baylor Scott and White Health News Network News. I've been asked by Associate Dean Gerald Scott Wieters to help provide second-year medical students with information regarding the choice in medical specialties. So it's our pleasure tonight on the Bswhnnn to provide you with that information with a special investigational segment. This piece will be unbiased, objective, and clear.
You, sir, random gentleman at the desk that I haven't spoken to yet. Oh, this is legitimate. Johnny Bswhnnn, one of the cardiology fellows here.
How you doing?
I'm doing great, thank you. How do you enjoy working here? Great. Now, among all the different specialties in this hospital, which one is the best? Cardiology, exactly. Why do you think that? Really the looks, but what else? I agree, the charisma is fantastic.
Yes.
Have you found anyone in the hospital who's better? Me neither. Thank you so much for your time.
We're here on location at the clinic here at Scott and White, talking to folks to see why they like working where they do and what they think the best place to work is.
The best place to work in is cardiology at Baylor Scott and White. We work with a group of people that are like energetic all the time and happy and, just want to give it their best.
I'm here with Dr. Thomas Bswhnnn, second year emergency medicine resident. And I have a question for you. Dr. Bswhnnn, you say in May you'll be doing your first rotation on the cardiology rotation, right?
Correct.
What's your biggest fear? That you'll discover on day 1 or day 2 that you should have picked a different specialty knowing that cardiology is the best? That says it all. Thank you.
Dr. Jepson here on location, interviewing patients to see just what their experience has been like. Hello, Mrs. Niedermeyer. Thank you for agreeing to speak. I had a brief amount of time here to go through your chart. Seeing like you've been seeing a lot of specialists.
Oh, excuse me, honey. I just have a bit of a cough. That's why I'm holding this sheet up in front of my face.
Okay, very fascinating. So, in your experience with going through all these multitude of health problems, what's been your best experience with the subspecialists that you've dealt with?
Well, I always like coming to the cardiology clinic because they have the best looking doctors and they're always so nice, and they've got to be really smart to be able to tell what's going on with your heart.
Ms. Niedermeyer, your blanket here is slipping.
Oh,
here.
my.
So, well, we certainly appreciate you taking the time.
How often is it that you can put people on treatment and literally cure them?
Pretty much daily. I'm a cardiologist.
Hi, Chris Childs here, and please tell us your name.
Mary Lee,
Okay, Dr. Lee.
Yes.
What rotation are you on currently?
infectious disease,
Great. And what are you doing for fellowship after this?
cardiology.
Hi, we're here with Dr. Candace Olson. Candace, what's your specialty?
I am an anesthesia resident.
How do you like it?
It's not cardiology.
Do you think the reason specialties like anesthesia, dermatology, radiology, all those coming out of medical school are so competitive is because people think that they lack the ability to become a cardiologist?
Oh,
I agree.
Well, hopefully we've given you a good idea of what cardiology is like, and hopefully we've given you an unbiased presentation, but it's pretty difficult to stay unbiased when one is clearly better than the rest of the choices in medicine. It's not very often that you get to take care of such high acuity and different pathology for patients. 1 second. Resume compressions. And with doing all that, just really being able to maintain a level of professionalism that our patients really, deserve. Ooh, that's a heart attack. Atrial fibrillation, no, that's a heart attack. Pacemaker, that's a heart attack. Oh, that's a heart attack. Whew. Well, we're going to head over to the cath lab. We got one more live to save. Okay. So thanks for coming along with us on this journey. We hope that you make the right decision. Now, if you'll excuse me, there's a heart attack. Got me.